Welcome to the Health is Number One video podcast. I'm your host, family physician, Dr. Craig Wax. Today we're talking about what has happened to treatment and specifically COVID-19 coronavirus treatment. And our special guest today is Dr. Jeff Barke, who's a family physician who's with Newport Beach Personal Care in California. Welcome, Dr. Barke.
Good morning, Dr. Wax. It's an honor to be with you this morning. I'm coming to you from beautiful Southern California.
Thank you for spending your time with us today. Our special topic today has to do with what happened to treatment with special reference to coronavirus and COVID-19. Can you tell us a little bit about your background and training before we tease out the topic?
Of course. So I'm a board certified primary care doctor. I've been in practice now for about 30 years. I went to medical school and did my family practice training at the University of California, Irvine, right here in beautiful Southern California.
So let's talk a little bit about what's going on. Let's pick up COVID-19 coronavirus circa summer here, where we've had the first and now the second quarter to deal with this issue. What's been your experience and what happened with potential treatments? What have you seen?
I've treated many patients for COVID-19, and unfortunately, this illness is being led by fear, not by science. And it's been unfortunate. Our government has way overreacted in shutting down the entire economy. And it's been a travesty and a devastation. And by the way, Doc, not just for our economy, but also for healthcare, meaning what most people don't realize that in addition to shutting down our economy and purposely causing over 30 million Americans to be unemployed, most of the outpatient and regular healthcare system has also been shut down. And as a result, patients are directly being harmed by their lack of access to routine medical care. So for example, routine screening for breast cancer, mammograms, pap smear screening for diabetes, thyroid disease, and arrhythmias that we often catch multiple times a year has been completely shut down. There's a study out of Ontario, Canada, where there were multiple deaths as a result of waiting for surgery and surgery that was deemed non-essential. So the non-essential nature of some of the healthcare system has been a bit arbitrary and capricious. And as a result, it's clear to me that there will be more patients harmed as a result of the shutdown and the lack of access to routine care than will have died from the actual virus itself.
So I'm just going to quote this back that although the virus itself is an issue as it spreads faster than influenza and it has an inflammatory component which can be dangerous to elders in the community as well as those with concomitant medical conditions, what I hear you saying is that the government shutdown and issues with regard to politics have caused potentially far worse damage, far more wide-reaching than the virus itself.
There's no question in my mind that that's going to be the case. And not just currently, but as we move forward, we're seeing the consequences of missed routine diagnoses as a result of our healthcare system being shut down. For example, I spoke to Mark McDonald, a board certified psychiatrist up in the LA area, and he reported that his volume was down 80%. And as a result, he was prescribing more benzodiazepines, Valium, Xanax, Ativan, than at any other time in his career because he had no option because his patients were too fearful to come in. And these are patients that need his weekly, sometimes bi-monthly help just to be functioning, managing medications, giving them a sense of purpose, his counseling that goes along with his prescriptions. And these patients weren't coming in. This is just but one psychiatrist, and this is being multiplied thousands of times throughout the United States. And you pick your specialist, And I'll tell you the illnesses that are being missed. I talked to a cardiologist that stopped doing all echocardiograms and non-invasive cardiac testing. So this is congestive heart failure patients, atrial fibrillation patients, et cetera, that are not being taken care of. And even though now the healthcare system is somewhat opening up, we're seeing delayed care being manifested by disease that in some regard is not going to simply be recovered by going back in to see the doctor.
So, Dr. Barke, I know that the telemedicine revolution is here, and a lot of people are doing things like we are right now with regard to video consultations, telephone consultations, and those kinds of things, but they're not a substitute for in-person care?
Oh, absolutely not. Listen, I've been doing telemedicine for many years. I have a concierge medical practice in Southern California, personal care physicians of Newport Beach. But there is no substitute to the doctor-patient in-person relationship and interaction. You can't substitute that by telemedicine. Sure, there are some things you can do. A patient can hop on Skype or FaceTime and show me a picture of their rash. They can open up their mouth and I can look into the back and see that it's red, et cetera. But that doctor-patient interaction cannot be substituted by a video conference. It's just not working. And when you think about certain specialties like gastroenterology, for example, routine colonoscopies, I don't know how you do that remotely, or various procedures that are done in the cardiac specialty as well. You cannot substitute that for telemedicine.
I see. In fact, a colleague of mine who's a psychiatrist, we wrote an article called "Lockdown Panic Syndrome" and how to treat it, because when COVID came around and it was somewhat unpredictable at the start. Now we have a lot more data on it. The government, primarily state governors, overreacted and closed things down. And as you said, we couldn't have access to surgery centers. And I had patients waiting 3 and 4 months for breast cancer surgeries, coronary artery bypass, things you would think would be urgent. They just didn't have the throughput and had to put everybody in line.
You're absolutely right. I've seen that over and over and over again. And even though we're starting to open up the economy and open up our country, along with that comes the mainstream media, again, broadcasting fear over the airways. And unfortunately, people are so fearful now to go about their lives that I think the fear itself is more harmful and potentially more dangerous than the coronavirus. I mean, remember, and you know these statistics, about 50% of the deaths in the United States has occurred in nursing homes and extended care facilities. And so for the average younger or healthier person, this virus poses very little risk. Something like 98.6% of patients that get this virus will have either no symptoms or will have very mild symptoms at all. And so there's really no reason to live our life in fear. You know, the reality is a healthy society takes the sick and isolates and quarantines them and protects the most vulnerable. We've gone about this completely backwards. We have locked down the healthy herd. We've prevented the young and the healthy from obtaining any level of herd immunity that ultimately will protect the most vulnerable. You know, the example I like to give, I have a patient right now with stage 4 breast cancer and is undergoing chemotherapy. And as a result, her immune system is being beat up and she needs to be careful. So she stays most of the time in her house because she doesn't want to expose herself to pathogens because of her immune system. And then when she does go out, she's extra careful and protects herself. What we don't do, Dr. Wax, is we don't ask her entire neighborhood to shelter in place to protect her. So we protect the most vulnerable. Certainly we isolate those that are sick, and we let the young and the healthy go about their business, many of whom necessarily will be exposed and will develop immunity to this virus. That's the way we overcome this, not by locking down our economy and asking our healthy herd to stay quarantined.
So to add to that, it seems that if we allow our younger folks or our healthier folks to go about their business and maybe take routine precautions depending on the individual's choice as to whether or not they wish to wear a mask, they don't wish to wear a mask, or what have you, that certain people will have asymptomatic cases and they will actually protect the people that are at risk, because it's like trees in a forest. If most of the trees have seen a bug or an illness and they're somewhat resistant to that now, the trees that are at risk won't be exposed because there will be ones that can fight in between.
That's exactly right. There's two ways to achieve herd immunity. One is the natural way, which is what we're facing right now, and that is allow the young and the healthy and those with very strong immune systems to go about their business. Many of them will be exposed. For every patient that is exposed and develops immune antibodies, that's a patient that isn't able to spread that disease to other people, and it protects the most vulnerable. The other way to achieve herd immunity is through vaccination. And I don't have any hope that we're going to have a vaccination anytime soon. We keep hearing about this, but I suspect it's going to be until about this time next year that we're going to have a viable vaccination. The other problem is when vaccinations do come online, they'll be brand new, they'll be minimally tested, and there's going to be a lot of patients that are going to fear a government mandated vaccination. So I don't want us to wait and look to a vaccination as a savior. We need to be able to achieve herd immunity and protect the most vulnerable amongst us. And I think that's the way forward. And unfortunately, there are many epidemiologists that agree with this concept. But when you say that, you're shut down off of YouTube, off of Facebook, off of social media. The mainstream media does not give the voice to those that are speaking this way with the concept of herd immunity. And when they do, they immediately bring an expert on to criticize the science behind the concept of herd immunity. So unfortunately, the media is making a living on the fear that's going along with this COVID-19. And I think that's a big mistake.
Yeah, that sounds like a very valid observation that we've seen over the last half a year in dealing with this. Is that the same thing that happened with hydroxychloroquine, zinc, and azithromycin, which seemed to be a somewhat effective treatment in independent physicians' hands across the world, and even possibly for prevention and disease mitigation? Is that what happened?
So the first time in my career, I'm not sure what's going on in New Jersey, but for literally the first time in my career, I am called and challenged by the pharmacist on my prescribing a safe, cheap drug that's been around since the late 1950s, and that's hydroxychloroquine. Hydroxychloroquine is used routinely to treat autoimmune disease. There must be millions of patients around the world that take this drug safely on a daily basis for things like rheumatoid arthritis, systemic lupus, and other autoimmune diseases. It's been discovered that this product, especially when used early and for mild symptoms, and when combined with zinc and zithromycin, can be very effective in mitigating the symptoms and preventing the worsening of this disease. I've used it multiple times. There's a local infectious disease doctor that has used it literally hundreds of times with excellent success and almost no side effects. So it's a very safe, very inexpensive medication that unfortunately, because our president mentioned in a press conference, has now become the first political drug in history. And it's very unfortunate. As a matter of fact, it's become so political that one of the leading health journals in the world, The Lancet, was forced to retract a story, a negative report on hydroxychloroquine, because the publication was filled with flawed data, inaccurate statistics. There was also a report by JAMA shedding negative light on hydroxychloroquine. And when you lift up the hood on that study, you realize they used doses almost twice the lethal dose of hydroxychloroquine, and then they come to the conclusion that the product is dangerous. Hello, when used safely, when used in appropriate doses, I follow the Zelenko method. I know you've interviewed Dr. Zelenko, and I think he's onto something. The combination of hydroxychloroquine, zinc, and zithromycin, especially when used early with mild symptoms and or used preventatively in high-risk situations, works wonderfully well with limited side effects, safe and cheap. And I just don't get it why this drug has become a political hot potato.
Yeah, I've had the same experience here in New Jersey. We have to have a positive test, and we've done shows on testing, and testing, unfortunately, has a very high false negative rate, which means it's supposed to be positive and it's negative, that we've done what's called empiric therapy. That is to say, we've made a clinical diagnosis by our experience and hands-on, and now we're prevented from doing that, which may be criminal.
You know, unfortunately, the science behind COVID-19 is very imprecise and not yet well delineated. It's trial and error of a variety of medications. It's trial and error of literally hundreds of different testing that's on the market. And we've lost now the art of medicine. There's a reason why it's called the art and practice of medicine. It's the relationship between the patient. It's the experience, wisdom of the doctor to understand the science as best as possible, and then to make an informed decision with their patient as to what is best for them individually. And unfortunately now, the media and pharmacies, etc., want to take that tool away from us to have that relationship with our patient and make an individual decision based on empiric and scientific evidence as to how to treat COVID-19.
Well, thank you, Dr. Barke, for helping elucidate this matter in summary form. I think you've done an excellent job of summarizing 6 months and the whole history of medicine in just 15 minutes. Thank you. So how would you sum up what's happened to treatment and leading by fear, not leading by fear, but leading by clinical experience and science?
Well, you know, I'm penning an article right now. Hopefully I'll have it out in the next week. And so far the working title is Immunity Matters. And we're seeing now guidelines for opening up schools, for example, with the over sanitization now of everybody, a squirt of hand sanitizer wherever you go, scrubbing yourself down at every occasion. And you and I both know that for functioning in this world that's filled with pathogens, viruses, bacteria, everywhere we go, it's important to have a healthy immune system. And part of having a healthy immune system is the chronic daily exposure to some of these pathogens that builds up our immune system. It's sort of like exercising. You know, we exercise and we build up a certain level of fitness that makes us stronger and better able to carry ourselves throughout the day. As soon as we stop exercising, our body atrophies, we become weaker and less able to do the things that we want to do. So we need constant stimulation of our immune system. And as soon as we start scrubbing ourselves clean and trying to sanitize the world everywhere we go, temporarily that might help, but ultimately it's going to hurt us because we're going to de-escalate and injure our immune system so it's not available to do what we need it to do when we come in contact with just normal everyday pathogens that are part of our life and part of our world.
Thank you very much, Dr. Barke. Can you tell us a little bit if someone wants to get in touch with you or find out some more information about this topic?
Well, thank you for asking. They can certainly follow me on my Facebook post, Jeffrey, Jeffrey, last name Barke, B like boy, Arke. My daughter made an Instagram account for me too, and that's RX for Liberty, RX4FOR Liberty. And on Twitter, I play around with the cesspool known as Twitter, and that's RX_for Liberty, RX_for Liberty. Your comments and your following is appreciated. I think we need to get a common sense medical perspective without fear out there so people can go about their lives safely and enjoy their God-given gifts to go out and be the best people they can be.
Thanks again, Dr. Barke. That'll wrap it up for another edition of Health is Number One podcast. We'll be back next time with another fabulous guest on another current important topic right here on Health is Number One. Thank you, and here's your Dr. Wax fist bump. For this and more information, you can go to healthisnumber1.com. You can also Twitter with us at the @ Dr. Craig Wax, DrCraigWax, and the same at Instagram and on Facebook as well.